Yes, thank you, Governor. I wanted to ask if you could discuss a little bit about the process of how health department officials stay in contact once a person has been diagnosed as COVID positive to track their progress, document recoveries, things like that. And is there any consideration to publishing that data on the state dashboard?
Yeah, the question is, once an individual in Virginia has tested positive, how do we use our tracing capabilities to follow that individual and their well-being and to make sure that they're not being exposed to other individuals? You want to comment on that?
Certainly.
Thank you, Doc.
Thank you for that question. In the normal process of doing contact tracing, what we do is first have very skilled case investigators, communicable disease investigators who go and interview the person who actually is ill and do that investigation and discover through that process who that person has been in contact with. And then we proceed to then find out whether or not those folks who've been exposed to someone who's positive for COVID-19 are themselves doing well and put them in quarantine. So we isolate the person who is ill, and the people who have been in direct contact with that individual we put in self-quarantine. And then we manage that, we track that, we talk to them and have communication to continue to see how they progress over the period of time in which they're under quarantine and direct them to medical care if that becomes necessary. While these folks are under our observation, we do not release their names to the public. We, of course, would release and encourage their names to be given to their healthcare providers so that they can be cared for and ensure that they get that care. And the other thing that we do is we look to providing them with the sort of support services that they need in order to maintain themselves in isolation or quarantine. So if they are staying at home, for example, or in some other domicile in isolation or quarantine, we want to make sure that they get the food, medications, and other services that they need.